So it's great to grab this hour with Dr. Paul, our resident aesthetic practitioner. Dr. Paul joined us here in Malahide Tolan's maybe 2-3 months ago now.
Yeah.
And oh my God, the response has been insane. So many people have booked in. He has an incredible reputation, but also we're finding friends and family of those that have booked in are looking to get in as well, which is always a great sign. So I'm going to have my own lips dissolved with Dr. Paul today, and we're going to capture all that in the podcast. I had my lips filled maybe 4 years ago, and I just found that a lot of the filler had moved beyond the margins of the lips. So we're going to have all that rectified, and we're actually going to take a deep dive on that whole procedure, because Paul was saying to me it's actually a very interesting topic within the arena of aesthetics right now.
Yeah.
But before we do that, we do have some questions that I want to run through to get as much value for you guys here. So if you're out and about, having a walk, driving the car, sit back and enjoy while we take a deep dive into aesthetics with Dr. Paul Coughlan. So could you share a bit with us about your medical career to date and how you came to arrive in aesthetics?
Yeah, so essentially I studied medicine in Trinity. It was a 5-year course. Liked all aspects of it, wasn't really sure what I wanted to do. I did my internship and then I went off to Australia for a while. Again, kind of dabbled in loads of different areas of medicine and wasn't really too sure. And I actually ended up working in the emergency department then for the next 5 or 6 years after that. So kind of on the side then I started getting into aesthetics, like just watching videos on it, really interested in it, mad to train in it. So at the time there wasn't much training opportunities in Ireland. So I actually went to the UK and trained up and then just started kind of doing friends and family and built up from there. And then last year I was able to kind of go full-time into it, and I don't need to do any kind of general medicine anymore. I just do full-time aesthetics.
Brilliant.
Yeah.
Okay, super. God, we were lucky to get you back from Australia, because doctors are treated like royalty over there.
Yeah, a lot of my friends actually stayed out there,
Yeah.
and aesthetics was huge out there at the time. That was the first time I saw it.
Okay.
There was a lot of skin clinics, aesthetics clinics, advertisement everywhere, and there was no mention of it in Ireland at the time. And then when I came back, it kind of had started then. So
Okay, interesting. Of course, the whole skin cancer thing in Australia as well, I think it's very much at the forefront. So what training do you find has been most impactful in shaping your approach to aesthetics?
So I actually think from the start, like, not just the aesthetic training, but the actual medical training itself, like, it's paramount. Most of what I do, like, most of it is actually just drug interactions and just drug management. So like it's not really procedural, it's more just, say for a botulinum toxin, you're measuring the amount and you want to try and get a result that you predict weeks down the line and then get a predictable result each time. So it's not as easy as like the needle goes in here. There's a lot of thought to it, and I think medicine has been as important as the aesthetics part for that.
Yeah, it is a real science.
Yes.
And the funny thing about it is, unlike normal or other aspects of science, when it's done really well, you don't notice because it just looks so good. But when it's done bad, it stands out so much.
Yeah, and if you just stick to the basic training and do the points like they say on the training days and such, you'll get a result, but you'll never really fully understand it and be able to get the best results. So there is a lot of thinking to actually get very good results. Whereas if you want to just do 3 areas, there's very little thought if you just do the same thing for everyone.
Okay, so you're kind of thinking outside the box with it the whole time.
Yeah.
What are your most popular treatments? People always want to know what other people are having.
So I actually broke this down a few months ago, and it was 80% anti-wrinkle, and it's usually 3 areas. Obviously there's difference, like some will get 2, some will get 5, some will get it for sweating, but usually it's 3 areas. Anti-wrinkle is 80% of the work, and then the last 20% is a mix between skin boosters like Profilo and fillers. Fillers are on the up in terms of more people are getting them, but people are doing less of it. So less mills, but more people are dabbling in it.
Okay, interesting. Yeah. And what about polynucleotides and skin boosters? Are they on the up?
Yeah, so Profilo is always popular. It's been like the market leader for 10 years or more now. But there's more coming to the forefront every year. And to date, nothing has actually really challenged Profilo. It's still been number 1. But in the last probably 2 years, polynucleotides came along. And they kind of took off in the UK and they were slow to take off here. No one was that much interested in it last year, and then since it's gone into the American market, it's gone very busy here. So there's a lot of interest in it. It's versatile in that you can use it in a lot of places. It's very good in challenging areas, and what's good about it is it's not filler, there's no long-term consequences, and it's all kind of biostimulation. So it's your own body doing it.
And it's that real natural enhancement. It's not adding volume. Like, I don't know if you've noticed, but I'm obviously watching kind of celebrities, Hollywood, all that kind of arena. And what I've noticed is that there was an over-reliance really on filler. And now that's pulling back. People are dissolving the filler and they're looking for that more natural.
Yeah, like if you look at America, it's a good petri dish for everything. In pharmaceuticals, they kind of overdo everything. So like from the weight to the lifestyle to being on lots of prescription medication. When they got fillers, they overdid it. So they used the only FDA approved ones were Juvederm and Restylane. So they used that for years. They used it everywhere. People got overfilled. People got puffy under eyes. And now they're doing these normalization clinics where people are getting everything dissolved and starting very modestly from scratch, which is way more appropriate.
And would you say that the synergy of using the likes of skin boosters, Botox, fillers, and obviously skincare and a lifestyle, that approach, a little bit of all, is really what gets the
I think
best?
the most important thing is the at-home skincare, because you can't really do much if that's not done correctly. Like Botox is a muscle relaxant, it doesn't do much for the skin. It'll just show off the good skin you have without the muscle movement underneath. So the most important thing is the at-home skincare. Then the botulinum toxin is great as well, and then little bits of filler, nothing crazy, is a good way. You don't want people to know, you just want it to look the same going forward.
So a big thing for our aesthetic virgins out there, if you wish, they're always worried about that first appointment. They don't know what to say to you. They don't even really know what they want done. What can someone expect when they book in to see you here in our clinics in Malahide, Balbriggan?
So like, I think it shouldn't be very clinical in that people are afraid, they feel like they're going to a dentist and it's going to be a really like a clinical thing. It's not really, it's not medicine, it's not life and death. You don't need to get anything. It's all just discretionary things that you want to do to feel good. You can do as much or as little as you want. So I think just come in with an open mind. You don't need to do anything the first day. It's always best to sleep on things. Come in, talk about what your issues are. I wouldn't focus on everything. I'd have like your problem areas and what you want to address, and then just start small and go from there. Don't get addicted to it. Don't do too much. Take it very handy. If anyone's ever telling you to do less, that's a sign to do a lot less. So that's the best way to go about it.
Well, now, funny you say that. There's a couple of points there. First of all, just as we came in, a lady who'd been in with you earlier had come back looking to have her lips done.
Yes.
And so what happened there was, again, obviously you just said go away and have a think about it, whatever. Probably not expect her back within a couple of minutes, but that's the way it goes. So that's important for people to know, is you don't actually have to have a treatment done. You can just come see Paul and have a chat and then decide yourself if you are still comfortable to go ahead with the treatment, etc. And then the other thing you were speaking about, I actually about 2 or 3 of my clients, I'd said to them, recommended, I said, I think you should have this, go see Dr. Paul, I think you should have this. And they came back and said, no, Dr. Paul actually said that I'm not a candidate for that. And I found that so interesting. And, kudos to you, because one of them, you said actually what you need is surgery. Another practitioner could have said, let me just fill the area, completely freeze your forehead. Hopefully that there would be some level of lifting your eyelids. But actually you were very honest from the start that that's not what Botox should be used for. You need a blepharoplasty. And she completely appreciated your honesty, and I know she said she's definitely going to take some time and to consider that going forward. And I think that's so good, because I have seen people even out and about, etc., and I've looked and I said, you're trying to lift your lids with Botox and it's not working. It's where you can get those vertical lines, etc., which are not natural. We don't usually line vertically. And it's literally where they're, and then the other thing is that's expensive, because you have to top that up every 3 months.
And you'll never get the desired outcome. And you just save that money.
For even a little bit of Botox post blepharoplasty can be fantastic. Fantastic, great stuff. So if you had to pick your top 3 treatments for someone looking for a natural, youthful appearance, what would they be?
I would say at-home skincare. Prophylaxis is best, as in prevention, so looking after your skin. Very hard to start if you have lots of static lines and want to go back a few years, but if you look after your skin, that won't be an issue. Then the next thing would be just basic anti-wrinkle, starting off with 2 or 3 areas, build up over time if you want to do more. And then the last thing would be very little bit of filler, like minuscule amounts, regular intervals, so like every year to do a little bit, just to kind of keep your volume. Not like filler was invented to replace where you've lost fat, not to make your lips massive, It's meant to replace what you've lost. So that's the best way to do it.
That's so honest as well. So Dr. Des Fernandez, who created Environment Skincare, he's a cosmetic surgeon, he's retired now, but I remember him saying one of the reasons why he created the skincare brand was he would lift the skin, pull the skin, tighten the skin, but if the skin is basically shit beforehand, it was still shit after the facelift. So that's why it's so important to make sure you have that healthy skin. And then the other thing was a couple of my own clients that have gone to you for Botox, and with regards to those static lines, what I have found is my skincare is so much more effective because the Botox has stopped. Like I've said to them, so if we have a year of little or no or far less movement in that area than what you would have had if you hadn't had the Botox, it gives us a chance to really help make that skin healthy. We're not fighting against that moving muscle.
And
exactly. Our trauma treatments get all the collagen, and then eventually you can lighten off a bit in the Botox and just have that lovely, again, that natural enhancement. And it is a science, really.
It is.
And it is all synergy again, when knowing when to rev up and when to pull back.
Yeah.
So what new treatments or technologies are you most excited about that you see emerging in the aesthetic world?
So America usually get a lot of the cutting edge stuff first. So they have Daxify now, which is a botulinum toxin that apparently lasts 6 months. It's not in Europe or Ireland yet. So that'll come to market soon. That'll hopefully, most plastic surgeons have moved from Dysport and Botox to Daxify in America because it lasts longer and it gets better results apparently. But when it comes, I'll try it and see. So that will be good. And then aesthetics, I suppose I look at aesthetics as a whole, not just skin and not just your face, but like as in looking good overall. So I think the most exciting thing at the moment is like the weight loss medication coming out. So like we're starting it in Ireland, like there's Saxenda, some people are getting Ozempic, but in a few months hopefully we'll have Wegovy, which is just designed for weight loss, and that will keep people kind of help with obesity, help with being overweight, and that helps your whole body, so your whole aesthetic will be much better.
Of course, cardiovascular, brain health, everything.
And that's in the UK, but it's not here yet, so hopefully soon.
And tell us, what's different about it? Is it an injection? Is it a tablet?
Ozempic, it's the same as Ozempic. It's semaglutide, but Ozempic is just for diabetes. So you're using it off-label for weight. However, Wegovy is made in the same factory. It's just a different brand on it, and it's just for weight. So it's exactly for weight loss. So you don't need to go in and pretend to be diabetic to get it. You don't need to have a stigma about it. It's actually designed for people that are a little bit overweight with medical conditions or are obese. So.
But then they're going to get the correct care and they're going to be weighed and managed and given advice.
They'll look better, but more importantly, their general health will be much better. They won't need as much tablets for blood pressure, cholesterol, things like that. So
absolutely,
that's exciting.
That is exciting. Are there any aesthetic treatments or trends that you would like to see lose momentum or to be gone and abolished? Is there anything you're like that
treads? I suppose people talk about treads a lot. I don't see anything with them. I think they're quite dangerous. I think a surgeon should probably be doing it, not just a doctor. I wouldn't go at treads. I think whatever you do, you should be able to fix yourself in-house. Like if I put in treads or anyone puts in treads and it doesn't go well, it's a plastic surgeon is taking them out. It's thousands of euros, you're going under general anaesthetic and someone else is taking it out. So and look, they don't give good results. There's a reason people don't go back for them,
I think they kind of are on the way out, aren't they? I rarely hear about them. Okay, so now we're on
expensive as surgery as well, so you're better off just going for surgery.
I mean, I had a blepharoplasty and I think it's the easiest and it just made so much sense to me because I'd had plasma pen on the eyes and I'm not a fan of burning skin tissue. My thing is skin is an organ and I wouldn't burn my kidneys for like aesthetic enhancement. So,
but people are doing treads to try and avoid blepharoplasty and it's just not the same.
Just go have the blepharoplasty.
Exactly.
Just have the blepharoplasty. And on that note, I'm going to have my lips filler dissolved with you today. So you were mentioning I should have a patch test. Will we do that now? So this patch test is sometimes you could be allergic to the hyalase, is that right?
So it's hyaluronidase. It's a natural substance in the body. It's actually in a load of tissues. It's interesting. It's in white blood cells because it helps them get through better through tissues into infected areas.
So if the hyaluronic acid is blocking their pathways.
So it buries through using hyaluronidase. And then the most interesting is it's actually on the head of sperm to get it into the egg.
Oh my God, I love it. So basically the egg is coated in like a hyaluronic acid.
And then the hyaluronidase, it breaks through and gets in. So this is
a
lab-made version
cool.
of that. 1 in 2,000 people are allergic. If you are allergic to bees, you have a higher likelihood of being allergic.
Well, I don't have any allergies.
So we carry an EpiPen and all the things needed. If you are allergic, it can happen. I've seen it once. It was actually only last week. She needed an EpiPen, but everything's fine. Like it's but it does happen.
And how quick would
within 15 minutes.
Okay.
So we do a patch test on the arm of a few units. And we keep an eye on it. And if it gets to be like a big nettle sting and an itchy red rash, we just avoid it. As in, there's no immediate need for you to get your lips dissolved. It's an elective thing. Like you want to do it, but if you have an allergy on the patch test, we can put it off.
Okay.
So we'll do the patch test now.
Okay, super. And talk to me about dissolving filler. When and why and who and I hope Crita doesn't cry on camera.
Sure.
Oh, there we go.
That's not bad.
No, it's not bad at all.
So you can draw a circle around it then.
Oh, okay.
And if that goes very red and blistery, then you're allergic to it. Or if you feel unwell, just let me know, but you'll be fine. 1 in 2,000. It's good odds.
Yeah, but it's still, probably with allergies, it's probably pretty high, is it?
Yeah, it is, look.
Yeah, which
it
is why you would do it.
And because there's, I suppose, non-medics doing this, it's very important to be doing it.
Okay, yeah.
You know, like most people wouldn't be able to manage allergy. When I had that allergy a few weeks ago too, it was the most I felt like a doctor in years, you know, because you're like call to action, like, and you're like given medication and actually have to think and stuff. But yeah.
Wow.
But so it's important to do the patch test.
And obviously it's better here than your mouth because
exactly.
your
And
airways.
it's only a few units where you'd be using a few hundred units in the mouth. You know?
Okay, gotcha.
Yeah, so you use about 150 units per mil of filler.
Okay.
So we'll be going through later how much mils you had and what we need to do.
God, I haven't a clue. I know I am such a chicken. I know I definitely said air on the side of.
Yes. And you only went once?
Yes.
Fine, yeah. Okay. And do you know what technique it was? Loads of injections vertically?
Sideways, maybe?
Okay, but loads of injections.
Yeah, maybe.
So it brings
like
me back to your
46.
it brings me back to your question why you're saying why it migrates. So like obviously very active muscle.
Okay, yeah. Never stop talking.
Everyone's is very active, eating, drinking, talking, everything. So it moves out. All filler migrates, no matter if it's put in by the best person in the world. Yeah,
Gravity
exactly.
is going to pull it.
Yeah, all filler moves. If it's done well, it's just done to the degree that when it moves, it's not visible.
Okay.
You know.
Yeah.
So the problem is people putting a mill into everyone blanketly, and then you'll have a mill everywhere in a few years' time. So you just have to be careful and allow what the tissues will allow. You know. So that's the big thing. But all filler migrates. It takes years to dissipate, if it dissipates at all. The pharmaceutical companies that make the filler say it lasts like 9 to 12 months. It doesn't. We have research to show it lasts years upon years. That new MRI study, you could see the filler. It actually gets bigger over time because the hyaluronic acid attracts water, so it gets bigger and boggier over time. So that's why we are on the side of caution with everything.
Okay. Interesting. And people, so if you've had filler in the past and you want to get rid of it and start again, that's obviously something that can happen.
Yeah, and it's great. We're actually seeing that day on day now, which is much better. You know, people didn't think they could get rid of it so easy, but you'll see now on the video it's incredibly easy.
Really?
You wake up tomorrow, it's all gone.
And the other thing is, would the styles, you know, and the trends with how filler is administered have changed? And that could be, like, I know I'm going to have my fibres lasered and start again because the technique has improved.
Now that's the thing as well, and like as a doctor you shouldn't ever really be doing things with a style, but it is in aesthetics, like Russian lips. You'll have, like, years ago people wanted huge brow lifts and now they have these commas above their eyebrow. I don't do anything with styles and aesthetics. Keep it very natural. Natural never goes out of style. It's circular in that all these mad fashion trends, eventually they look stupid in a few years. So if you just keep it natural, it'll always look well.
Yeah, you know? Okay. I'm thinking those green tiled bathrooms. The red kitchens in the 80s.
Yeah.
Okay, great. So are you happy? Look.
Yes.
Not a histamine cell to be seen.
Yeah, exactly. We have our
So I guess we're going to need to take off my lipstick. I can do that here with some pre-cleansing oil.
Yes. And then, so you have two options. We talked about this off camera earlier. You can do it with numbing cream, or you can do it with a dental block. Numbing cream, there's still an element of pain because it's just topical cream.
Yeah.
But with the dental block, there's no pain at all. And it's quicker onset, so it's good for this. So we'll do the dental block.
Yeah,
once you're happy with
and
that.
tell me, I'm potentially going to be a little bit swollen and a little bit bruised, I would imagine.
Yeah, so when you go home, you'll be puffy. It's not something you don't plan events after this. Like, this is an elective dissolve. Here, I'm going to put 1 ml of solution in. So it's going to be worsen the problem in the acute sense for the next few hours. But when you wake up in the morning, you'll be back to normal.
Well, do you know what I have done, which I think is very clever? Because one of my co-business owners in the village is celebrating 10 years in business, and I've been invited down. So I've brought a COVID mask and let's pretend I've got a little dose.
Yeah, exactly.
Now she knows, I told her.
Yeah.
So
no, it's good, and there's never really a good time to do something like this. So you're like,
and what are, let's say I'm thinking of a bride, etc. How long, like, if you're planning and you want to get your lips freshly done, would you dissolve maybe 6 months before the wedding?
So like the longer you can wait actually between refilling, the better, because you want your tissues to snap back tight for the filler.
Okay.
You know, if I dissolve this and refill in a few days, they won't have snapped back, like, so they'll still be loose. So you want to get that elasticity back. So the longer you can wait, so definitely 2 weeks, but longer is even better.
Okay. Well, I'm happy to wait.
Yep.
Okay.
Right. We'll start now, Karina, if that's okay.
Yeah.
So it's going to be 2 injections off the top and then the bottom. Do you ever have this in the dentist?
Yeah, I guess I probably did.
Have you ever got a tooth out or?
Yeah. Oh, yeah.
Yeah. That's the hard part.
Okay.
So the rest is pain-free.
Okay, perfect.
In a few minutes.
Oh, this is where I'm going to be like biting my lip, that kind of thing afterwards,
Yes.
you know.
It's better than the pain of this stuff.
Oh, for sure. And what, it takes about 4 hours to wear off?
About that, yeah.
Yeah.
Starting to feel numb? Mm-hmm. Should be immediate enough.
Yeah, it's all tingling.
So you tell me if this is sore, okay? Sharp? No?
No.
Completely no?
Yeah.
Yeah, good. So it still can be a little sore, so just tell me to stop if it is very sore, and we can always do more.
Okay.
So, little cannula goes in. How's that?
Perfect.
Yeah. So now we'll do the bottom lip here, and then I'll go over to the other side.
And does it dissolve straight away?
So, it starts working straight away,
Okay.
and it works for about 24 hours. So that's one side done. So it looks scary in the camera because it looks like a giant needle, but it's actually not. It's blunt. See it right back in the middle. How was that pain-wise?
Oh God, like 3 out of 10. Feels like my lips are huge, of course.
So there's a mil gone in on top of what you had there.
So they are huge.
So they are. Yeah. That's why but they go down like hour upon hour.
Okay.
And then when you wake up, they'll be back to normal. Some people need a second dissolve, very rarely. I think you'll be fine.
Okay.
So that'll last a few hours, that feeling, and then they'll be gone in the morning. But like, yeah, it compared to anyone who's got this before will tell you that it's usually incredibly sore.
Yeah, that's what I've heard.
Yeah, that's why most people are reluctant to get it. So hopefully this changes people's opinion on that.
God knows, fine. I certainly wouldn't let the pain factor put me off.
Yeah.